Um, I'm Yumin Ding, and I come from Taiwan, and maybe I can say, how old am I? I'm already 36 years old, and I'm a physical therapist, and I work in my own clinic. The clinic is specific for scoliosis patients. And why I decided to open my own clinic, because after I learned the Rigo Concept BSPTS, I find I need a price to do this, because in the past I work in the hospital, but if we work in hospital, we don't have enough time to treat patient. Maybe every time patient come here, it's only have 20 minutes or even shorter than 10 minutes. So I cannot tell a lot of about PSSC. Maybe I just can tell her you can do anything what you want. You can do exercise. You don't need to worry about what your life will become, what happen on your life in the future. So I decide leave the hospital and have my own clinic to do what I really want to do. I want to spend a lot of time on a scoliosis patient, maybe 1 hour, maybe 2 hours a time, and I can give them what I want to give them. Yeah. Actually, because after I graduated from university, I continued to study in graduate school, and the topic I research is scoliosis. But why my topic is scoliosis? Because I'm a scoliosis patient. Yes, I have the structural lumbar curve. So I know what the patient thinking about, and I know what my parents worry about. So when I was a child, my parents took me to so many places: chiropractic, swimming, just like a lot of things. And I tried traditional massage, yeah, just like that. So when because the scoliosis topic is not so popular in university, so I don't know so much. And when I go to the graduate school, I learn this topic, and I need to search so many research. And I know, oh, there is a therapeutic method. It's called PSSE, and I am interested. So that's why I went to Barcelona in 2014 to learn about it. So that's my first time to know the Rigo concept, and it helped me a lot. Yeah, because my parents start to tell me, you have scoliosis, you should sit how the good position, or you should do something. I just tell them, I know it's not stop my life. I can still very happily. So you don't need to worry about this my body anymore. I can handle it. Yes. So yes. So it's my pleasure. It's my, I say Rigo concept. I touch it. It's really helping a lot and changed my life so lot. Yeah. My life. Great person. um, Very smart one and amazing hands. Yeah. Just an angle. Yes, we need to control it. So, if the father really worry about her child, maybe she is 12 years old, have 35 or 40 Copenhagen degree. Okay, I will want to know how's the child thinking about. It's only a parent's worry, or this child is also worried about her scoliosis, because I want to let them know, yes, 12 years old, 35 or 40 degree is maybe a progressing scoliosis, but it's it can control. Maybe we need to say we can help you tried and this family to try to handle this scoliosis. Maybe we can try to stop it, or maybe we can try to find the other way to keep your child, to keep this child have a better life. But the first things, I need to see this child face to face, because I want to know what she's thinking about. And then with her parents, and we need to ask if after I assess her situation, I found yes, maybe still risk sign 1 or still risk sign 0. So I need to give the medical recommendation to maybe she need to wear a full-time brace and with PSAC, because she is a high potential of the risk progression. And I need to see the reaction face to face on the child's face, because maybe she need to shock, or maybe she start to cry, and maybe she is really worried about her scoliosis. Okay, if she says she doesn't want to wear to school or whatever, okay, I will ask her, so you are worried about your scoliosis, right? So maybe because if she is risk size 0 or 1, I will say, but now the first thing we need to make sure you are progressing, or maybe you are, we can do other things to stabilize, or maybe after 6 months we control well, we can maybe decrease the wearing time of the brace, but you need to keep the PSAC together. But if you feel you do everything but it still progress, we still need to wear a full-time brace, because it's not your fault, but you just on this high potential, so we need to do something to match your risk. If your risk become lower, of course our treatment could be maybe a little decrease to let your life better. Just like this way, yeah. Actually, I don't think everyone has pain. Maybe you also have pain, some pain maybe 2 years ago or right now, or maybe, I should not say, but maybe 1 year later. So everyone maybe have pain in the future, because you can think about when you go to a clinic, rehabilitation clinic, everyone do the lumbar traction, or everyone have low back pain, shoulder pain, neck pain. Do you think everyone have scoliosis in a clinic? Yeah, maybe it's not. So everyone have maybe one day have the chronic pain or sharp pain one day, but it's not mean it's related to the scoliosis, because we have lots of evidence based tell us it's not really a relationship between them. But we still need to learn how to control it, because right now the focus is this child has scoliosis, maybe 30 to 40 degrees, and have maybe high risk of progression. So the first thing is not in the future she may have pain. It's right now we need to help to control it. But after we can control it, she can live just like the general adult, because the research tells us she can get married, she can have child, and the numbers of child is the same with general adult. So I don't think it will affect this child. She can maintain the active life, just like me. I have active life. Yes, so we can try to help you, and we not only help right now, we want to help you to reduce your anxiety, to worry about in the future, but we don't know what happened. You can do a lot of support outside. You can do the fitness exercise, because we know even I don't have scoliosis, but do some exercise, do some fitness exercise. It's also helped me to be maybe more happier, more healthy. So your doctor just like the usual adolescent. They are not the difference. Yeah. If there is a therapist in Taipei, and she had a scoliosis patient, and she asked me, because I'm a physical therapy too, and I'm a Rigo Concept teacher, and maybe she's asking, does she need to learn Rigo Concept, and why? And I will tell her, for example, okay, what you know about the scoliosis, or what's your plans? You decide to do something for your patient, because maybe in university what we learn is about we can do some massage to release the concave side, or maybe strengthen our convexity side, but or maybe doctors say you need to train her, the physical therapist, you need to train her trunk extension or something else. But if you don't really know the scoliosis history, the natural history, maybe you train her body, okay, do some trunk fitness. Maybe you do this way to train your back muscle, but what we know is this will maybe induce what we call localization from the scoliosis. So if you tell me you want to train the back extensor, I will choose maybe, for example, put on a Swiss ball, and maintain her body in the neutral alignment, so she can train the back extension, back extensor, but without this slight hyperextension. So as a medical professional, I think you need to know what is the scoliosis. You need to know its natural history, and then you will maybe treat you. You can treat her and not harm her body. And the Rigo Concept PSSC is specific for physical therapists. It's a physical therapist method to treat the patient. So if you are a physical therapist, I of course need to suggest you should take this course, and you will know scoliosis very well, and at the same time you will know how to treat them, and without compensation, because we look 3D alignment in the same time. Yes. I want to tell the patient who have scoliosis, or I want to tell something to the maybe you have your children have scoliosis. I want to tell you that scoliosis is not a terrible thing, because um, if we know how to control it, it's not it it it's just inside your body. But for example, if you introduce yourself, or maybe this is our first time we meet each other, I think you will not bring your X-ray to show, hey, this is me, this is my X-ray. You can just show what you are, and you just look like very just the same with each other. So you need to know scoliosis is not a really big thing. If you are a child or you have a high risk, we need to learn how to control it, because we need to learn everything at every stage. And just now, this moment, you have scoliosis, so you need to learn to know it, to handle it. But it's not mean your life, all your life is a scoliosis life, or you live in a scoliosis house. So I want to tell you, we can help you. We can control it together, and we want to make your life better, or not any trouble, or not any you need to worry about scoliosis in the future. I feel if you know how to control it, you can forget it, because you just like the other people walk on the street. Yeah.